I think, as everybody's well aware, we're still continuing to have a fair amount of COVID-19 activity. We're seeing a fair amount of other respiratory infections circulating, and we also are starting to see influenza infections as well. So we anticipated that this was coming. We anticipated that this respiratory season, which is essentially the fall and the winter months where we would usually be seeing these viruses, would be potentially more challenging than previous years. And I think that we will continue to see more and more of this activity in the upcoming months. So to start with, from the big picture perspective, these are some statistics related to what emergency departments across HKPR region are seeing related to both influenza-like illness as well as for respiratory infections. So this data is captured in provincial databases. Whenever somebody shows up at the emergency department and they're describing what symptoms they have to the triage nurse, that nurse is inputting the information into a database and using keywords like cough or fever or difficulty breathing. And what this surveillance system can do, which is a provincial system, can go through and use those keywords to help us define what people might be presenting with a respiratory infection or respiratory illness, and what people might be presenting with an influenza-like illness. It doesn't tell us their diagnosis, but it gives us an overall picture of those types of what we call syndromes, which is a collection of different symptoms leading to a certain type of illness. So this graph right here, which is these blue bars, so started this respiratory season or this flu season, which is end of August, beginning of September. And we can see pretty clearly that the number of visits to emergency departments since the beginning of this season has more than doubled. So we expected this, we knew it was going to be increasing, it happens every year. Difficult to compare to the last 2 years because we didn't see influenza and we didn't see a lot of other respiratory viruses because of the different public health measures that were in place, such as distancing, requirements related to masking, this sort of thing. When we look at provincially what the impact of these numbers are, as they say, it's compared to other areas of the province, we're at a moderate level of what the impact is. I think what's important to remember is that that this increase overall in the number of people coming to emergency departments for either influenza-like illness or respiratory infections is one side of the equation. So we have an increase in demand, but at the same time, we also have healthcare workers that might be getting sick, or healthcare worker shortages, which means there's less available staff in emergency departments. And so this is really creating to a number of challenges, not just in our jurisdiction, but across the entire province.